I started to get unhappy with the way the cellulite on my thighs was looking, so I decided to do something about it. Over the past couple of years, and it's really starting to bother me, so.
Is it cellulite? It's estimated that 85% of adult women have cellulite, and I think the other 15% think they have it. Cellulite itself is the thinning of the skin, the dimpling and that contour irregularity, along with the pics, which are the depressions caused by the fibrous septae, which are pulling down the skin. Finally, there's extra fat beneath the skin causing that cottage cheese look. So there's three parts that actually cause the cellulite: the extra fat, the thinning skin, and those fibrous septae. And we've used many techniques to get rid of cellulite. There's been rollers and potions and lotions and lasers and all kinds of things have been tried, but nothing until just now has been successful. SideLaze is the first effective long-term solution for cellulite. SideLaze employs a tiny fiber optic laser that allows us to go gently under the skin through a tiny pinhole. This is a minimally invasive procedure. The laser can be aimed upwards, sideways, and downwards by your doctor to treat the three problems of the skin architecture. Melissa has moderately severe cellulite. In fact, on the Stevens cellulite scale of 1 to 5, I would give her a 4. So we can really do a lot to help her today with the new SideLaze. This is the laser firing down. The bright light accounts for about 60% of the energy. Then you have some energy going forward, which helps us move through the tissue. The bright light is doing most of the work to eliminate the cellulite.
I'm a little nervous about the SideLaze procedure, but I trust Dr. Stevens to do a great job.
Rules are 1,000.
All right, 1,000 joules.
47 degrees.
With a shut off at 50 degrees.
Close to
44 degrees. Melissa's procedure is finished now and she's done great. She tolerated it very well, she was comfortable the whole time, and we could feel those little irregularities disappear with the laser.
It's been 3 weeks since my SideLaze procedure, and my cellulite has gotten a lot better. It's supposed to keep improving for several months.
Melissa is 3 weeks out now from her SideLaze treatment and she's looking terrific. Her thighs are smooth and the pics are gone. Her cellulite is eliminated.